On.
So this is a really cute 6-week-old male with a chief complaint of vomiting. The baby was fed with was in his usual state of health until this past week, where he started spitting up after every feeding. The vomit looks like milk. Sometimes it's curdled. It's never green or bloody. Mom says it makes a big mess every time. She's breastfeeding and pumping, and sometimes gives pumped breast milk in a bottle, but she gave some formula last Tuesday. She thinks it was about 5 ounces of Enfamil. Normally the baby breastfeeds for 10 minutes per side every 2 hours, and the baby has about 5 wet diapers a day with 2 non-bloody stools. So nutrition, the baby takes breast milk, but formula milk last Tuesday. Developmental, he smiled last week, he tracks to midline, he lifts his head while prone. Sleep, he sleeps on his back in a crib, no medications, and no allergies. Review of systems: no fever, no cough, no runny nose, no eye discharge, no ear pain, no neck stiffness, no breathing difficulty, no sweating, no diarrhea, no problems with urination, no problems with sleep, no rashes. Past medical history: he was a full-term SVD. Mom is a G1 PO1 who has good prenatal care and normal labs. Her blood type was O positive. HBS antigen, RPR, and GBS were negative. Family medical history: grandmother has hypertension, grandfather has type 2 diabetes, there's a cousin with Tourette's syndrome, and a maternal great-uncle with lung cancer. Social history: mom and dad are from Nicaragua, which is really cool. I've never met anyone from Nicaragua. Baby lives with mom and dad. Dad's an engineer, and moms teach school, but she's on maternity leave. She plans to pump breast milk and go back to work in a couple months. No one smokes, no pets. So on physical exam, temperature is 37, heart rate 110, respiratory rate 40, and weight and length are at the 40th percentile. The baby was alert, crying but consolable. His lips seemed somewhat dry. Red reflex was present bilaterally. I didn't check the ears. Neck is supple, chest is clear. Cardiac exam shows regular S1, S2 with no murmur. Femoral pulses were 2+. Abdomen has normal bowel sounds with no masses or organomegaly. GU was normal, hips were stable, spine was straight. And my assessment is that this is a baby with vomiting. The differential for vomiting in infants includes malnutrition volvulus, UTI, pyloric stenosis, viral or bacterial gastroenteritis, gastroesophageal reflux, or formula intolerance. So we could do a KUB to look for a volvulus, or an ultrasound to look for pyloric stenosis, or stool culture, or urine culture, or maybe do we do stool eosinophils to test for allergy?